Good morning, and thank you for joining us for SBB Live. I am your host and the publisher of Seniors Blue Book, Amanda Barton. First, I want to wish you a very happy new year. 2021 is finally here, and I couldn't be more excited than to bring on one of my favorite professionals to listen to, Dr. Kabbash over at Physicians Regional Hospital. How are you this morning?
I'm great, Amanda. Thanks, and Happy New Year to you too. Very happy to be here.
Absolutely. Well, thank you so much for spending the day with us. We appreciate it so much. I want to learn a little bit about you, your background, and what brought you into the field of medicine.
Okay, I am an orthopedic surgeon. I practice in Naples, Florida at Physicians Regional Hospital. I trained in New York City at Columbia, did my residency, Mount Sinai in New York City, my foot and ankle fellowship, St. Vincent's in New York City. And I'm also an athlete. I enjoy doing Ironman, so I'm all about health and fitness and keeping the mind and body healthy.
Yes, for sure. And that's one of my favorite things about listening to you is that you're able to really talk about a number of different things. So the first thing I want to ask you to go into a little bit about just some overall things that we can do for health and wellness as we are in a new year, and New Year's resolutions seem to be this is the time for us to start making some changes. So talk to us about that overall health.
All right. In terms of overall health, one of the favorite things I like to say is if you don't use it, you lose it. All right. And this is especially true as we get older. As we get older, our muscles, our brains, our blood vessels, everything can essentially become stiffer. And the body remodels in response to use. So, there have been studies that have shown that if you exercise to 70% of your maximum heart rate capacity several times a week, your blood vessels are healthier, your brain is healthier, your memory is healthier. So I think these exercise is certainly one very important thing to do in the coming new year, as well as diet. I think we've learned a lot about diet in the past few years and found that uh, inflammatory foods or foods that we no longer tolerate as we get older can really contribute significantly to issues as we age.
Yeah, and I think we've all experienced that through COVID, trying to balance our diet and exercise, along with just keeping our mental health up and continuing to thrive. So, you did kind of touch on this. How important is diet and exercise? Are there any specific diets that you recommend that people look into for the 2021 year?
So there's a lot of diets out there. There are some that say, no protein, go vegan, certain fats, no fats. I'm more in favor of a moderate approach. So I believe a lot in balance. But it's also important to make sure you're eating foods that you can tolerate. So I guess overall, fresh fruits, fresh vegetables, fresh meats or fish or chicken, if you're going to eat protein. Try to avoid processed food, boxed food, food with preservatives, food with additives, food with hormones, and just keep, I think, as pure and healthy a diet as you can. Healthy mind, healthy body.
That's right. That's right. And that's one thing that, we've always kind of touched on as far as brain health is concerned is to know what you have a tolerance or an intolerance for. In my case, would be gluten and dairy. And it's really hard not to have that bread at the restaurant, but, we do have to listen to our bodies. So,
And actually, you bring up something very important. So there's a lot of people who, when they're younger, they tolerate milk, they tolerate gluten or wheat. And as they get older, they start to have stomach issues and just don't feel well and their joints hurt. And they actually don't realize that over time and over years, you can develop intolerances to these foods. So, if you are starting to have stomach issues, cramping, bloating, joint inflammation, I think maybe one of the things you can do in 2021 is try cutting your diet down to a minimalist, seeing how you feel, and then seeing what happens as you add foods back.
yeah, and I was going to ask, just out of selfishness here, can you undevelop that allergy or that intolerance? Is it possible for your body to reverse that, or once you have that intolerance, are you kind of stuck with it?
So if it's a true allergy and not an intolerance, the answer is yes. You can go to an allergist and you can be exposed, for kids now, peanut allergies. So you can be exposed to very tiny amounts of allergens and then sort of maintain that. Um, and in that sense, develop a tolerance to an allergy. But if it's more of an intolerance, your body just doesn't have the enzymes to, digest the lactate or lactose in milk, nothing is going to change that.
No, no. All right. So just get used to it, Amanda.
Just change your diet.
Yeah, it's easier said than done, but I have done it before and kind of slacked on it. So it's time 2021, here we go. We're gonna make this right this year for sure. So your specialty, what you went to school for and what you practice at Physicians Regional is really deals with foot and ankle. So that's your expert field. Talk to us a little bit about first of all, balance is so important. And I know that exercise can really help with that. But talk to us about some of the common things that you see in your practice as far as problems that people have with their feet.
Okay, so again, I am an orthopedic surgeon. My specialty is foot and ankle, but I also deal with trauma all over the body. And I take care of a lot of athletes, so I'll deal with shoulders, knees, but my specialty is foot and ankle. And then with regards to what I see a lot of in my office with foot and ankle, I would say I see a lot of problems actually come with getting older, especially being in Naples. So one of the things I tell my patients a lot is that as we get older, our feet get longer and wider. Okay. And it's not that our feet are growing. It's that as we age, our arches naturally fall. So as the arch falls, if you can imagine an arch falling, the foot lengthens and spreads. Okay. With the lengthening can come the flat foot and the arch rolling in, and with the spreading can come the bunions and the hammer toes. Other things that happen as we age is that we lose a lot of fat in our feet, and especially under the balls of our feet, and we lose a lot of muscle tone in our feet. So those things can contribute to, pain walking barefoot and issues um, associated with pain in the balls or the heels of the feet.
Okay, now that's about feet in general. Talk to me about some of the ways that, especially, we're seeing probably more and more of this, and statistically, it's causing more deaths. Just simply falls. What are some ways that people fall that you don't think of, and what are some ways to prevent falls?
Okay, so balance is probably the most important. So I would say, any exercises you can do at home, that focus on your balance. I think a really good and easy one to do is you take a stack of towels and then you try balancing on one foot on the stack of towels, holding on to a dresser or a door jamb or something on the side. And then when you feel really good at it, you can either add a few towels to the stack or practice closing your eyes. And these will help train what are called proprioceptors, or the balance nerves in your feet. So that's certainly one way you can work on it. The other is to make sure you have good strength and agility. So if you start to fall, your body has the flexibility to adapt and catch it. And the other, I think, with all the masks that we're wearing, people sometimes don't see over the mask and they don't see their feet. And I'm seeing a lot of people walking into the cement parking barriers and parking lots, more than I used to see in the past.
Now that's interesting. You wouldn't have thought of that. So a new thing that you have to worry about in 2021 is to make sure you're looking over your mask.
Yes.
Oh man. Well, what other advice do you have for us as we go into this new year? Because as you said, there's a wide variety of topics that you cover, and just simply aging in place and making sure you stay healthy. You're so good at that. So any closing remarks that you might have for the viewers today on this brand new day of 2021?
Absolutely. If you're thinking about, incorporating exercise into your regime in 2021, calories in, calories out, I would say, make sure a couple times a week you get yourself up to 70% of your maximum heart rate. So what is that? Okay. So the general rule is 220 minus your age. So if you're 70 years old, 220 minus 70 is going to be a max heart rate of 150. So there have been many studies that have shown that if you exercise 2 to 3 times a week at your max heart rate, you're going to increase your blood vessel elasticity. Okay, so you're going to decrease problems with blood pressure. You're going to help turn over your muscles, your joints. You're not going to be as stiff. Um, and you're also going to contribute to brain health, because when you exercise, there's actually a brain factor that's released that improves memory. There's no pill you can take for this. So the only way this brain factor is made and released is through exercise. So it has been shown to stimulate memory. And the other type of exercise that's important to put in is really weight bearing, heavy exercise. So that means, doing leg pushes or squats, doing lifting with your arms, okay, to the max weight that you can. Why? It increases bone density. Why does it increase bone density? The pull of the muscles on the, again, bodies respond and remold and regenerate in response to stress. So the pull of the muscle on the bone actually stimulates the bone to increase density. And that's how strenuous, like weight, strength type exercise increases bone density. So swimming in a pool, biking isn't going to increase bone density. It really needs to be strength exercise.
That's really interesting. So let me go back to hitting your max heart rate, just because I just did the math for myself off camera, and I would need to be at like 182. How long do you need to be there?
You can keep it about 20 minutes.
Woo. Okay. I was proud today on the elliptical when I hit 165. So now I
So
know.
it's just a goal, but you want to be, well, so you want to be 70% of your max heart rate. So
Okay.
if your max heart rate is 180, you want to be at 70% of that. So you were probably there.
Thank God. I'm like, I don't know if I can get it up to 182, Dr. Kabbash. I don't know.
And certainly somebody who hasn't been exercising and has been sitting on the sofa, it's going to take a little while to get up there. But that's half the fun, constantly improving. We can still improve as we get older.
Yeah. And that's
And
what it's all about, is setting those goals and just trying real hard to not just make it a New Year's resolution, but make it a way of life, and a habit. So I'm going to try to practice what you are preaching and get out there and make it happen this year.
excellent.
All
And
right. Thank
there's
you so
fun
much.
ways to do it.
I appreciate it, and I will keep you updated on my progress.
Excellent.
Thank you for your time this morning, Dr. Kabbash. Have a great day.
Oh, you too.